All right, guys, so I'm Brandy Bengoa, and today we're going to discuss access to transportation and creating and implementing a public transportation system for Lander County. So, underserved populations are groups of people or areas that have limited access to services needed for quality healthcare and adequate quality of life. These underserved populations experience disparities that put them at an increased risk for poor health outcomes, as well as a decreased quality of life. Each underserved population will encounter individualized barriers which decrease their availability for access to care. In Lander County, a primary barrier we're experiencing is the access to transportation. All right, so here you're going to see a list of the underserved populations, all of which we have in Lander County. So access to transportation is a barrier experienced by many of the individuals in Lander County. It affects not only those seeking health care, but also access to necessary essentials. When assessing the overall health of Lander County, it is encouraged that locals seek preventative health care services to ensure their health is on the right path and to quickly identify and resolve health issues should they arise. Unfortunately, those who are at greatest risk for poor health are also the ones who do not have access to transportation in town as well as out of town. This is also discouraging due to the lack of specialty services available here in Lander County, which require individuals to travel at least 54 miles to see a specialty provider. So here you're going to see some statistics for Lander County. Currently in Lander County, transportation is provided in town for those who qualify for services from the Lander County Senior Center. However, there's no transportation available for the individuals who are less than 65 years old or those who need to travel out of town for services. This service is also not advertised, so few know of its availability. Prior to the pandemic, Medicaid transport services was available to assist Medicaid patients with transportation in and out of town. This service was eliminated locally in May of 2019, and no timeline is available for when this service will be available again. No public transportation or taxi service is available in Lander County, so implementing and offering public transportation to underserved populations would increase the quality of life and the overall health of underserved populations. All right, so in order to implement a source of public transportation for our Lander County residents, we must first secure a vehicle, as well as somebody who's available to transport these residents as needed. These tasks would be best served if funded and employed by Lander County. Currently, Lander County has several of their previously used senior citizen vans in their fleet, any of which would serve the purpose at hand. In order to staff the van, I would request that Lander County hire a full-time employee for the job. If this is found difficult, several departments in Lander County could provide an employee 1 day a week to fill the spot. These departments would likely include the community health, the senior center, the recreation center, and the civic center. It would be a stretch to employ the bus with current county employees, but with a structured schedule should be manageable. If Lander County is not interested in funding the transportation service, other options do exist. One of these options would be to create a nonprofit or profit organization for public transportation. With the initial use of donations, the vehicle could be secured and purchased from Lander County. The nonprofit would then submit donation requests to Lander County, SSR Mining, and Nevada Gold Mines to assist with the employment of the bus as well as maintenance and fuel costs. If this is the route we take, a small fee may need to be charged for transportation services. All of the stakeholders that would be impacted by this change would all benefit from the services being provided. Local health centers and businesses would have an increase in sales and service as these individuals would be able to get out and about for doctor's appointments and shopping. It would also be nice to provide transportation to self-care appointments as self-care assists with the overall well-being of the patient. Out-of-town businesses and health centers would also see an increase in services as these individuals would have access to appointments they rarely attend. Providing a needed service that allows residents to seek appropriate health care and service needs will greatly increase their overall health and well-being of the community, resulting in an exponential response for Lander County as a whole. In order for this transportation service to be successful, support from Lander County's commissioners and administration would be greatly needed. This is due to the financial, administrative, and employment needs of the business. If this became a nonprofit venture, the assistance of a team would be needed. A business model would need to be created, and a team would be necessary to carry out all of the tasks at hand. In order to communicate my desire to provide a public transportation service in Lander County, I've already discussed this idea with the county manager. It will also need to be discussed with the commissioners. I will provide a quality presentation during a commissioners meeting combining all the information in regards to underserved populations, detriments of health, and the need for the service in Lander County. This will require the commission to either take action or step away from the venture. As this will be done during an open meeting, it will also allow for community input. I have no doubt, and I hope, that public transportation will be supported by the community as it's needed by so many. The greatest risk to this project will be not having the Lander County stakeholders, commissioners, and administration's approval. However, many businesses in the county are built without their support, and this includes other nonprofit agencies in our area. Another risk would be the liability of transporting large groups of individuals and maintaining their safety. This topic is something I'm very heartfelt about and I've been invested in for a few years. I'm hoping that with this background and this presentation that I will be able to take it to the stakeholders and provide a service that grows.